Hi everybody, how are you? I hope everybody will fine. Today we have a NCLEX nursing questions. 50 questions we have, and it's about fundamentals and nursing, mental health and psychiatric nursing, maternity nursing, pediatric nursing, and nursing pharmacology. Each of them including 10 questions, and we have two gifts ebooks, and top 3 candidates with high score, we will send the books. Please don't forget to write your email address to the chat box. And I will share my screen. Are you ready? Please enter the PIN. We will wait 1 minute and then start. Let's start. First time question about fundamentals of nursing. A nurse caring for a patient with infection disease who requires isolation should refer to guidelines published by. CDC. To institute appropriate isolation precautions, the nurse must first know what? Yes. Third question. After having an IV line in place for 72 hours, a patient complains of tenderness and burning. What IV site indicates? A patient must receive 50 units of familiar regular insulin. The label reads 100 units equals 1 milliliter. How many milliliter the nurse administer? A patient has just received 30 milligram of codeine by mouth for pain. 5 minutes later, he vomits. What should the nurse do first? Yes. The other question, when examining a patient with abdominal pain, the nurse in charge should assess. Yes. The nurse is assessing a post-operative adult patient. Which of the following should the nurse document as subjective data? Patient experience of pain description. Okay. A male patient has a soft-freeze safety device. Which assessment finding should nurse consider abnormal? Cool, pale fingers. Other question. When administering drug therapy to geriatric patient, nurse must stay alert for adverse effects. Which factors make drug adverse effects? Aging, radiation, psychological change. To evaluate a patient for hypoxia, the physician is most likely to order which laboratory test? Arterial blood gas analyzers. For a female patient with anorexia nervosa, nurse is aware that which goal takes the highest priority. Yes. The other question. Nurse is aware that the victim of domestic violence should be assessed for what's important information. Collagen can be used to treat conditions other than hypertension. Nurse is aware fellow condition might the drug be administered. What's that? A patient begins to experience alcoholic hallucination. Nurse is aware that the best nursing intervention at this time. Yes. Nurse is aware that assessment finding the most consists with early alcohol withdrawal. Yes. Other question. Which nursing intervention would be most appropriate if patient develops orthostatic hypotension while taking elevation? True. She with manic episodes is taking lithium. With electrolytes, which electrolyte level should the nurse check before administering medication? Sodium. Nurse is caring for a patient who has been diagnosed with delirium. Which statement about delirium is true? He with the diagnosis of depression is started of tofranil 75 milligram by mouth at bedtime. Nurse should tell the patient that what? True. Which of the following would the nurse most likely expect to find assessing a pregnant silent with absorption placenta? Here is a maternity nursing question. A pregnant patient asks the nurse if she can take castor oil for her constipation. How should the nurse respond? True. Immediately after delivery, nurse assessing the neonatal's head for signs molding. Which factors determine type of molding? True. Patient is taking a progestin-only oral constructive or mini pill. Progestin use may increase the patient's risk for what? A patient with pregnancy includes hypertension probably exhibits which of the following symptoms? True. After administering betacol to her with urine retention, nurse in charge monitors for adverse effects. Which effects? The nurse in charge is reviewing a patient's prenatal history, which findings indicates a genetic risk factors. True. Which of the following would be inappropriate to assess in a mother who is breastfeeding? Which change would the nurse identify as a progressive psychological change in the postpartum period? When administering magnesium sulfate to a silent with preeclampsia, the nurse understands that this drug is given to what? Yes. The nurse is aware that the most common assessment finding in a child with ulcerative colitis is: we start pediatric nursing questions, refuse the area, child age 6 is brought to the health clinic for the routine checkup. To assess the child's vision, the nurse asks should which applies to the defects emerging from residual peritoneal fluids confined with lower segments of process vaginalis. Child failed to pass mecanum within the first 24 hours after birth. This may indicate which of the following? Which of the following organism is the most common cause of urinary tract infection in children? Yes, multi-selected question. Which of the following should be included when developing a teaching plan to prevent urinary tract infection? Please select more. And we have 9 minutes. We can be fast. Nurse is assessing inflates reflex in a 9-month-old baby. Which of the following should identify as normal? Which of the following is the most common permanental disability in childhood? Patient is a teenager suffering from osteomyelitis. The nurse would expect which of the following symptoms? Select more. In children diagnosed with sickle cell disease, tissues damage results from which of the following? Yes, last 10 question. Last 10 question about nursing pharmacological. When caring for a silent with total parenteral nutrition, what is the most important action on the part of nurse? Which is the least likely to influence the potential for the patient to complete with lithium therapy after the discharge? And patient is to receive a percutaneously inserted central catheter. He asked the insertion will hurt. How will the nurse reply? Patient insulin dosage in 10 units regular insulin and 15 units of NPH insulin is in morning. She expects first insulin peak. When she expects? Yes. Patient is experiencing diarrhea after consuming her prescribed antibiotics for the whole week. This is because what? Last 4 minutes. When patient with chronic obstructive pulmonary disease is taking the Foley, also receive ciprofloxacin, which occur. Which of the following statement is true when educating patients about penicillin therapy? In treatment of tuberculosis, the therapeutic rationale for combination drug therapy is to what? Changes in visual acuity and color perception are associated with treatment by which of the following agents? And last 2 questions. Patient is a 16-year-old student, has acquired systematic fungal infection. He should be treated with. And the last question, which of the following is true about protease inhibitors? Yes, we chooses the winners. Please write your email address our chat box. Congrats, all of you. I am waiting for your writing chat box. Congrats, Iram, Tuba, and Nur. Or you can send email our community email address or Instagram page, whatever you want. Not at all, Iram. We have only 1 minute. Thank you for your participation. See you next competition.